Dr. Archer, a very good evening to you. Now, you say that this model is going to harm the entire SA healthcare system. You say that we are going to see our doctors and other healthcare providers going or leaving the country. Which part of this model, or is it all of it, that's going to cause this, according to you?
Well, I sincerely hope, good evening, I sincerely hope it doesn't happen. But, you know, I mean, we've been concerned for a long time about how this model is going to be financed. And despite discussing it with the Department of Health for a number of years now, we're still no clearer as to how the funding model is going to work. We are aware that the intention is to fund healthcare for the whole country through a single fund. That means private healthcare funds and state healthcare funds will be pooled to provide one source of funding for everyone. The problem we have is that the numbers just don't seem to add up. There's from our calculations, there's probably going to be a deficit of between 300 and maybe as much as $450 billion that is going to be short in terms of the required amount of money to provide adequate health care for everybody.
So what's the solution here, Dr. Archer? I mean, we have a majority of poor people in South Africa who don't get the best health care. They deserve the best health care. How would you propose this be done?
Well, I think the problem is, you know, I don't think a proper analysis of the problem has actually been done. The government is implying that the problem is a financial one, that there's not enough money. We don't believe that that is the issue. We think the problem is more at a management level, that the public services have been allowed to run down because of poor management, so that there are stockouts occurring, there are equipment failures. There are many aspects as to why service delivery is poor in the public sector and getting worse all the time. And we need to fix that aspect rather than find additional funding. Now, we don't believe that the funding that they will achieve through this model is going to be adequate enough to provide the sort of health care that is being envisaged. And the consequence of that is that the level of healthcare service that will be available to the average South African may even diminish. And following on that, we think there may be a big exodus of skilled personnel, which is the last thing that we would like to see and what this country can afford.
Now, I see that the forum is seeking a meeting with the Minister of Health, Doc, and I'm wondering, what is it that you would tell him? What proposals would you go to him with to say, this is how we think this will work?
Well, we have put forward proposals to the minister, the previous minister, of course, and we would dearly like to be able to sit down with the new minister to try and understand better the ideas that they have about national health insurance, because it is not clear. There's no detail in the funding, and particularly being from the private sector, we believe the private sector could have, if it was allowed to, play a very positive role in providing healthcare services. And we think there are reforms that can be done that will achieve this at a fraction of the cost that this model envisages.
Dr. Archer, what would you say to criticism out there for those who might say to you, this is just about those private doctors or those private practitioners who don't want to find themselves treating the poorest in the public healthcare system?
No, I think that is absolutely wrong. I mean, I think all doctors, I haven't met a single doctor in conversations that they haven't expressed a willingness to participate. In fact, the doctors that are here because they've made a decision to stay here, and they will as long as they are able to earn a living and provide a service. Now, if, you know, we have no information about how private sector doctors are going to be remunerated. What we do know is that the Minister of Health is going to set those fees. Now, if those fees do not take into consideration the very real costs of providing health care, the services come at a cost. There's no free lunch. And unless those factors are taken into consideration, then doctors will leave, because if they cannot cover their costs and at least earn something for their retirement and to enable their children to be educated, they will look at pastures new. There's no doubt about that. There are a number of doctors who would be happy to go back into the public service, but there are a lot of doctors who, for various reasons, would not want to do that. They would want to be able to continue to provide private healthcare services within a national health umbrella. But this model doesn't seem to allow for that, or if it does, it's not clear to us quite how it's supposed to happen. And that's a big concern, because between now and when it is actually officially launched, I believe a lot of young doctors, and we've seen the statistics, more and more doctors are leaving, and they're leaving because of confusion about the future as much as anything else.
All right, thanks very much for that insight, Dr. Chris Archer there from the South African Private Practitioners Forum.